This is about clinical approach to diagnosing excessive visceral fat in people with HIV. Let's think of it as a stepwise approach. Start with clinical assessment, then physical exam, followed by labs. If uncertainty remains, or if the patient is high risk, imaging studies should be used. Yearly assessment of waist circumference is recommended with special attention to excessive weight gain on antiretroviral therapy. As of physical examination, waist to hip or waist to height ratios are more accurate. Laboratory data could be supporting. Imaging studies are gold standard, and those are CT or MRI. However, we need to balance precision with cost and time. Thank you.